Hi, glad you could join us. I'm Annette Scherman. This is Community. I guess we have a few really good hospitals in our community. However, Sarasota Memorial Hospital is very special to me. And it seems to me they're always doing something new and exciting at Sarasota Memorial Hospital. We're going to be talking about some of those new and exciting things. We're going to be discussing epilepsy and Parkinson's disease with two experts. And if you recognize the prevalence of these diseases, you probably also realize there's someone in your family that suffers from one of those diseases. Let me introduce my guests. Let's start with Dr. Dean Sutherland, and Dr. Sutherland is with Sarasota Memorial Hospital. He's a board-certified neurologist, and he's also director of your training.
I got a PhD at Florida State University before going to medical school, and during that I had to run a monkey lab and raise the monkeys and go home with monkey on my clothes. That's
kind of fun, though. But something happened to make you focus on medicine.
When I was in high school, I started volunteering at a hospital similar to what people do at Sarasota Memorial Hospital, and I got to watch a couple of surgeries, particularly a C-section. And I was just so enthralled by the fact that a doctor could help bring life into the world and save lives. And
so medical school was the thing. You said you had two children, were married with two children at that time, came home. So that basically what the practice of neurology is having to do with the neurosystem. I'm making that phrase up. Yes.
I mean, it's amazing how much of the body actually is entailed with the neurological system, from the head to the toes.
Specializing in Parkinson's.
They also need to exercise for mental health, to prove to themselves that they can still do the things that they would like to do.
We're going to be talking later on in the program, maybe alluding to it even this section of the program, about support groups. Very important aspect. We'll get to that in a moment. Diet recommendations for people on PD meds.
Very important. Parkinson's disease medications are affected by things like protein. And so it's really important that people take their medication before they eat, 30 minutes before.
They're told this by their physician, but
hopefully
they tend either to forget or not do it as effectively or efficiently as they should.
Right. I've been surprised by people who've been on medications for years and have come in and not ever heard this. So it is surprising, but it makes a big difference in terms of how the medications are taken up into the body and how well they work.
Local programs available. This is what we were probably talking about a moment ago, to help people manage the disease. We're talking about support groups?
Yes, support groups. Marilyn Tate, who I think we'll talk with later, wonderful woman. She has been running our Parkinson's support group here locally for at least 10 years. And that is a great resource for patients. There's also a caregiver support group that she'll probably mention as well. There are some other support groups. There's one in Manatee County, there's one down in Venice.
Their surgical treatment of Parkinson's disease. I saw I think it was 60 Minutes, of some surgery that was done, amazing results. I don't think the results were long-term. Talk about that, doctor.
There was a short-term result called a pallidotomy that was done. We don't really do those anymore. Now we do deep brain stimulator surgery, which we think is a very long-term solution.
Deep brain
stimulator.
Stimulator. And how is that invasive?
It is. There's a small hole that's drilled in the top of the skull, and we put an electrode down into a very specific part of the brain called the subthalamic nucleus. And it goes in on one side, and it helps control the tremor and movements in the hand. It can also help with voice volume, facial expression, sometimes with walking.
Great success with this.
We've been very pleased with it. We have a lot of patients here that we've done surgery on. James Schumacher is our neurosurgeon. He's known worldwide for Parkinson's disease surgery and has trained most of the people in this area.
Of Sarasota Memorial Hospital doctor, James Schumacher.
Yes.
So that this is exciting. You said about soft speaking. Why does that happen?
The motor portions of the brain that are normally supposed to allow you to control your muscles voluntarily are somewhat stunned, or they don't work properly, and so you don't project your voice. Your diaphragm doesn't close up as hard as it needs to.
You can't, even though you want to.
Right. Right. So they actually have to think about it, whereas you or I wouldn't even think.
Right.
When you're trying to talk to someone across the room, you don't have to think to yourself, oh, now I need to speak up louder. You don't think that.
It just automatically happens. The brain just sends a little message and it happens.
For them, it doesn't.
There are new developments, and this is kind of exciting. I'm not sure I'm going to pronounce these properly, doctor, but you'll understand. Azilect, A-Z-I-L-L-E-C-T.
Good. Azilect, good pronunciation, is a new drug that's been out actually for about 10 years under study and 3 years in Europe, about 1 year here. That is the only drug that's been shown to slow down the progression of Parkinson's disease, and one of the best trials they have, which is a randomized controlled trial.
All right, so that, again, we're going to talk about trials and the kind of things that people can get involved with in both of these instances. It's downhill, I pronounced that correctly. All right, here we go. Neuro patch.
Good. Neuro patch is also a new medicine that's been out for a couple of years, but it has become available in the United States now. It's a patch you change once a day.
It's obviously a patch that you put on, okay, with medication in it that affects the problem.
Absolutely, and the nice thing is it's 24-hour release. With Parkinson's medications, the oral ones have to be taken 3 or 4 times a day, which is really a pain. A lot of patients who could take that many medications.
Yeah, who remembers.
Yeah.
So the patch is a wonderful improvement.
It is.
And then you have an Exelon patch, another patch.
Now that's for a separate problem. Patients with Parkinson's disease can have a memory disorder that looks very similar to Alzheimer's disease. And so Exelon is a medication that works well for it orally, but now they've come out with this patch, which is very easy to administer.
Love what you're saying. Gene therapy.
A lot of people have been talking about stem cell therapy for
Yes.
Parkinson's disease for years now, and
Yes.
eventually that may happen. But gene therapy is a really interesting thing, and I don't think we have the amount of time to talk to you about how it's done. But you can actually trick a virus into injecting human DNA into the cells in your brain.
So you're looking forward, if I'm reading you correctly, Doctor, you're looking forward to some really massive forward movement in
Absolutely.
Yeah.
I think Parkinson's disease is one of the diseases that's been moving forward the fastest, and there's more things coming out now in the last 5 years,
Exciting.
and probably more in the next 10.
Exciting.
It's wonderful.
If anything we're talking about is of interest to you, I'm sure most of it is, but you want more information, you can call 917-7777, really easy number. Or if you want to do it on the internet, it's SMH, Sarasota Memorial Hospital, smh.com, and that should be on your screen now. Doctor, the Neuroscience Center of Excellence for Southeastern Parkinson's.
Yeah.
Let's tell me about that.
So Sarasota Memorial Board has therapy